Our program, the clinical aspect of it, resides in the Norton Children's Cancer Institute. We have a primary focus on making sure that we have an outstanding clinical program, we have innovative research and academic excellence, as well as training our fellows to be strong clinicians, educators, or physician scientists.
Our program is a small fellowship program. We take one fellow every year, and our small size is strength. Each of our fellows, they have their own unique learning style and career goals, and our program is very flexible to provide them with what they need to be happy during the fellowship and successful in their careers.
Because we're a smaller program, a lot of the teaching and the mentoring is tailored to the fellow. So if they prefer one-on-one learning, we have attendings who will sit down and go through papers with you. I think that really made a difference for me.
Trainees here are given a high degree of graduated autonomy, which is something that's sacred in training. If one never has the autonomy, they can't learn, because one needs to be able to try things and say, hey, I think this is what we need to do. Is that going to work or not, or what are the consequences of that? Our faculty are very involved. They don't just retreat to their labs or their offices and shut the door. I mean, they're there in a supportive role for our fellows, and to make sure that they're getting the good training in a supportive fashion.
In our fellowship program, we have the philosophy of providing the best opportunity for fellows to develop clinical and research skills. We have a very extensive collaboration with our basic science department colleague, and also with the translational research colleagues, and we are developing bringing new therapies to our patients as soon as possible. And we are doing in projects that are scientifically outstanding and clinically relevant.
We are the first state in the whole country to have received state grant funding for childhood cancer research. We're actually proud about that.
The Kentucky State Legislature has appropriated $22.5 million for pediatric cancer research since 2018.
I think that opportunity for fellows is an amazing opportunity for them to be able to navigate through things that are common and things that are really not very common in an environment that's very, very collegiate. And so we have to be multidisciplinary for the care that we provide. And so it gives the opportunity for the fellow to interact with all of the other disciplines that we have to interact with, and gives them the experience that they need as they go forward, because everybody wants them to succeed.
I believe as a team, we all value teamwork. We believe it's very important. We believe in the importance of supporting each other. We do value kindness and respect. And we are just one happy family.
Our program provides great opportunities for fellows to learn to diagnose and to treat both common and rare diseases that concern a variety of blood diseases and cancers in children.
You do see a wide variety of patients, and from different economic backgrounds, different cultural backgrounds, and as well as varying different types of disease and disorders that we treat.
You get a really good patient population. You see things here in Louisville that you don't necessarily see everywhere else, and you get a little bit of everything. I've seen leukemias, I've seen tons of brain tumors, I've seen solid tumors, I've seen lots of inherited bone marrow failures, I've seen sickle cell disease, I've seen hemophilia, you name it.
We do have the benefit of, being the state hemophilia, having the state hemophilia program, being the main sickle cell center, having a transplant program, having a freestanding children's hospital lends itself to being more a tertiary referral center. And then on top of that, having great ancillary services, because you're only as good as your surgeon, your which is your radiologist and your team.
We are able to have most, if not all, the services that can keep children in Louisville, in Kentucky, in the surrounding area, and not have them have to go to other centers, so that families can feel comfortable getting the care that they need at home and not going elsewhere.
The benefit of having the only freestanding children's hospital in Kentucky is that throughout the hospital you find everybody engaged and focused primarily in the health and well-being of children and how to bring about the best treatments and outcomes for the children. And the hospital, focuses a lot not just on the medical side of things, but also on the whole family. And the family and patients are the cornerstone. So it's important to have a life outside medicine, and our city of Louisville provides great opportunities for that.
There is a lot of outdoor space, there are a lot of parks, there are a lot of places to kind of explore.
Louisville is a small city. It has everything that a big city would have, but it is relatively kind of quiet. So it has the charm of a small city, and then the benefits of a big city.
When I was looking at fellowship programs, I looked for a group of people that I would be comfortable with working with for the next 3 years. People who are very evidence-based about their decisions and are not afraid to reach out to people and ask for help. Doing fellowship in Pediatric Hemonc is not an easy thing, and I really wanted to be able to be mentored by people who had compassion and were really passionate about teaching a fellow.
I do believe that there are no limits to what we can do to improve the program. I hope that every year the program will be better than the year before it, and I hope that each of our fellows will be able to contribute to our program's growth and success.